First of all, on behalf of the direction of our institution, I would like to thank Dr. Miró for accepting to coordinate these webinars. I also want to thank him for inviting me to participate in these seminars, in which we want to share our experience with colleagues all over the world who are also facing this terrible crisis. Since we attended our first COVID patients in February 25th, everything has gone very fast. While several measures were established at community level to avoid that the epidemic peak overcomes our health service capacity, we were worried that they wouldn't be enough. In our hospital, in less than 3 months, we have attended more than 2,300 patients. 12% of them required admission in intensive care unit, and unfortunately, with an 8% in hospital mortality. These figures are dramatic, but the fact that terrified us the most was the high rate of patient admission in middle March. Those days, more than 100 patients were arriving to our hospital, and we thought that would be collapsing. We were also afraid of not having enough ICU beds to attend those in critical conditions. I still remember this day as a real nightmare. As soon as we started our contingency plan, we focused on increasing bed capacity, decreasing patient mobilization, and reducing exposure of our professionals. To achieve these goals, we reduced surgery and other non-critical activities. In this slide, you can see a schematic representation of our hospital before the pandemic. At each shown, we have 35 hospitalization units, 7 of them devoted to critical patients. Just 1 month later, we were able to double our ICU capacity, dedicating 32 out of 43 hospitalization units to COVID patients. However, it wasn't enough to face the large number of patients coming to our emergency department. We needed to establish an alliance to other centers near the hospital, both public and private. We've never been collaborating to each other in a so close manner. But again, it wasn't enough. We needed to convert a 4-star hotel into a sort of community hospital with capacity to attend up to 450 patients in fully equipped rooms with oxygen, X-rays, and pharmacy. But again, it was not enough. We needed to convert a pavilion able to attend up to 250 additional patients, which fortunately, we haven't needed to use it at the end. However, the most important transformation of our hospital was the one related to the professionals. In order to reduce their exposure to the virus, we organized twin teams, one working at home and the other working at the hospital. Moreover, to cover the new hospitalization units, we asked for volunteers to work at the front line. To this goal, we changed working conditions and reorganized care activities. We also recruited senior medical residents and researchers, as well as students working as health assistants. Everything went as smooth as possible, thanks to a well-defined communication plan in which any decision was told to the whole organization daily. In my last 3 slides, I will try to point out which was, in my modest opinion, the clue to face the pandemic in our hospital. First, professionals have shown an extraordinary commitment to our patients and society, with a dedication 24 hours a day, 7 days a week. Second, all of them has demonstrated a terrific responsibility in their corresponding category. Third, respect among colleagues was essential to facilitate the decision-making process in a similar manner as the solidarity and generosity that everyone has been exercising these days. Last but not least, a high dose of humility was critical in all the time. And what was the role of the hospital direction? During these weeks, we tried to be as close as possible to everyone, coordinating movement and ideas suggested by our colleagues. Indeed, none of us was expert in this kind of emergency. we realized that it was very important to keep calm and to decide the best judgment we could in taking decision. And we also did our best to convey confidence to the people that we would win this battle. Finally, and probably the most important contribution we have done, is to thank the great effort that everyone has been doing all the time. Thank you so much for your attention.